تسمعني بابا؟ حبدي اوكي. راح نكمل هذه المحاضرة اللي هي regarding the examination of the tongue. وصلنا البلاك hairy tongue وقلنا there are different structures which could be representing the surface of the tongue, and sometimes it may associate it with the changes in the normal bacteria or yeast, and this may occur due to the continued use of antibiotic, and sometimes poor oral hygiene could be one of the etiological factors which is initiating or formation of the black hairy tongue, in addition to the dry mouth or xerostomia. Anyhow, regular use of the mouthwash, which it is usually continue rotating, may continue oxidization agents such as peroxidase, or continue use of tobacco, drinking of alcohol, or coffee or black tea, or diet which doesn't help to rub the skin from the surface of the tongue, soft diet. This, what we call it, the pure tongue, and mostly associated with glossodinia or burning mouth syndrome. Mostly this area could be demonstrating on the lateral surface of the tongue, the border of the tongue. And sometimes we could demonstrating the whitish area on the surface of the tongue. And those types of patients sometimes may associate it with a burning mouth syndrome. We have to know that the oral candidiasis or thrush, which is considered to be as yeast-like a fungi, a candida, it is considered to be as a yeast-like a fungi. Sometimes it is going to be representing as a thrush. And here, the result of this infection of the oropharynx and the Candida albicans, this is typically a patient with immunocompromised, like for example, diabetic patient, or patient use of chronic use of antibiotic. As a result, there will be change in the normal microflora of the oral cavity, and fungi infection is going to be increased. Here, the patient may representing to the dentist as a painless white plaque on the surface of the tongue or on the oropharynx, which could be easily scrapped off, and sometimes it may associate it with onteophagia, which suggests that the esophagus is also involved. We use here the nystatin or the antifungi type of a treatment. But before use any type of a treatment, in order to treat it, the Candida infection, the white-coated tongue, we have to search about hidden causes, why those types of patients may associate it with a white-coated tongue with overgrowth of the Candida species on the surface of the tongue. We have to investigate it, whether this types of patient is considered to be as immunocompromised, or sometimes diabetic patient, or those types of patient who is taking a chronic antibiotic use or heavy dose of antibiotic. The result of use these types of medication, this may associate it with a change in the oral flora of the oral cavity, and as a result, the Candida species is going to become superly imposed on the surface of the tongue, and we could demonstrating the process of the white-coated tongue also. Sometimes we could demonstrating the presence of transverse furrows across the surface of the tongue, which is considered to be as a benign condition. This is what we call it scrotal tongue. Furrows that are longitudinal along the length of the tongue, sometimes it may result from syphilis. We could demonstrating the creating surface of the tongue. And sometimes we could demonstrating the presence of the hypertrophy of the follate and the circumflex papillae in this area. Sometimes we could demonstrating the fissure tongue, longitudinal groove, the lateral groove, or what we call it here, smooth surface of the tongue. لاحظ هنا the smooth surface of the tongue, loose of the papillae, وهذا الفيشر tongue. The smooth surface of the tongue, which is considered to be the most causes of the burning mouth syndrome. Sometimes it may associate it with a nutritional deficiency. This may include iron or folate or vitamin B12 deficiency. A patient with a vitamin B12 deficiency, here we could demonstrate the presence of the sore and beefy red in color. Sometimes it's called glossitis, and here the surface of the tongue will appear smooth and female is going to be affected more. And there is a specific condition which is called menopausal glossitis, which is mostly occur in female. لاحظ هنا again another condition which is going to be affected the tongue. And here it is characterized by an area of redness and loose of the lingual papillae, the central dorsal surface of the tongue. Mostly occur in a patient who have inhaled steroid or smokers. And it is considered to be as chronic atrophic oral candidiasis. Any hematological deficiency, hematological changes, hematonic deficiency, or any diabetic should not be excluded. Therefore, further investigation for these types of patients is recommended. مثل ما راح نشوف. The next slide. Medium rhamnodglositis. Loose of papillae in this area. Now it is considered to be as a candidal infection, but further investigation is important to see if the patient is diabetic or have any hematological abnormalities. Loose of the papillae, the dorsal surface of the tongue. Other things which should be noticed also during the examination of the tongue is the presence of the ulcer. Anyhow, the ulcer which is going to be representing on the lateral surface of the tongue, it is considered to be as a serious condition. And here we have to instruct the patient for further investigation. هذه الألسر التي تكون على السيرفس of the tongue should be carefully investigating. We should investigating whether these types of ulcer may associate it with pain, and if it's associated with a present of other mucocutaneous types of lesion, and also the distribution, the color, and whether it is going to be respond to any types of treatment or not. Sometimes it is considered to be as just a simple condition. For example, the aphthous ulcer, as we know, the minor aphthous, the major aphthous, the herpetiform type of ulcer, which is going to be represented as a pinpoint size and mostly multiple. And sometimes it may associate it with dysphagia or odontophagia, audiophagia, which is going to be affected the posterior surface of the oropharynx also. Most important things that we have been taken into consideration when we are going to investigating any patient who have a recurrent aphthous ulcer, that many of the systemic diseases may associate it with recurrent aphthous ulceration. هذا recurrent aphthous قد يكون أثناء الانفستيجيشن هو مجرد recurrent aphthous ulcer. That is to say, it is not associated with any other systemic diseases, or sometimes it is considered to be as a serious condition. These systemic diseases that may associate it with a recurrent aphthous ulcer, Crohn's disease, or the ulcerative colitis, which is considered to be disorder of the GIT. Sometimes this ulcer may associate it with the involvement of skin or involvement of the joints. And here we have to investigating about Behjet, which is going to be affected all the oral mucosa. Again, Reiter's disease, and the another causes of the recurrent aphthous ulcer going to be included the following: the Marshall syndromes, sometimes it may associate it with Reiter's disease, and so on. أريد أن أوصل في هذه الفكرة أو في هذه المحاضرة فيما يخص examination of the tongue. إنه recurrent aphthous ulcer of the, sometimes it is considered to be as just a recurrent without any systemic involvement, or sometimes it is considered to be as a serious disease and further investigation is going to be recorded, is recommended, sorry. أيضا أرجو أن تنتبه على هذه العبارة: any single non-healing erythematosus painful ulcer, the gastrolingual or oral cancer, and especially if the patient is consuming a lot of amount of alcohol or tobacco, or if the patient may have a family history. Therefore, please do not ignore any types of ulcer which is going to be representing the lateral surface of the tongue, especially if does not respond to treatment within 14 days, biopsy is indicated. Lateral surface of the tongue mostly susceptible to develop squamous cell carcinoma, and specify if it's associated with lymph node involvement. في حياتك العملية ابني، وإن شاء الله من ما راح تتخرج وتكمل، لما نشوف any ulcer and this ulcer associated with lymph node enlargement and does not respond to the treatment, sometimes may associate it with a bleeding or irregular margin, or it is going to be increased in size. To specify if this ulcer is located on the surface of the tongue, please do not ignore this ulcer and try to make a further investigation, or even you are going to refer this ulcer for the specialist who is responsible about that. هذه النقطة المهمة ابني، لا تهمل أي ألسر يكون على lateral surface of the tongue في حياتك العملية. لأنه sometimes it is considered to be as a serious condition. The medium RAM أو geographic tongue, loss of the papillae. مثل ما نلاحظ هنا أيضا sometimes it is going to be representing on the lateral surface of the tongue. It is going to be change its surface, change its position from time to time. بالmucous membrane of the tongue, mostly located on the dorsal surface of the tongue. As I say, it is characterized by smooth, red depapulating or loss of the papillae, loss of the lingual papillae. When we are going to make an examination within first time, the second time we could see that it is going to be migrating within or over time. ولهذا سميت بالmap-like appearance of the tongue. Exactly, these patches do not know how it is going to be formed. It is mostly considered to be as a benign. Therefore, reassurance of the patient is very important. And also, we cannot excluding the burning sensation that may associate it with a geographic tongue. And sometimes, even when we are going to prescribe the type of medication, those types of patients does not respond to any type of a treatment. And they are continue complaining from burning mouth or burning on the surface of the tongue. هذه the most common types of lesions which may associate it, or most of the anatomical variation which is going to be presenting on the surface of the tongue. Even during examination, sometimes we could demonstrating some of the cysts, like brachial cyst, cervical cyst, which is going to be arising from the rest of the epithelium, or sometimes the thyroglossal cyst, duct cyst, or the globomaxillary cyst, interior palatine cyst, and the nasolabial cyst. These are the most common types of cysts that we could demonstrating during the examination. هذه السيست أيضا فهنا أعتقد we covered most of the aspect of the examination of the tongue. أعيد بصورة مختصرة. حطينا examination of the tongue في محاضرة واحدة للأسباب التالية. Sometimes it is going to be manifesting serious condition. Sometimes it is going to be manifestate of many systemic diseases. تكلمنا عن الاناتوميكال structures of the tongue. قبلها أخذنا فكرة the developmental of the surface of the tongue and how it is going to be formed from the pharyngeal bulge. تكلمنا عن الانرvation of the tongue أيضا عن طريق الكوردا تمباناي الانتيريور 2/3 والبوستيريور 1/3 وتكلمنا عن different anatomical structures which is going to be representing on the surface of the tongue وعرفنا which type of ulcer should not be ignored during the examination. وكان السكند aspect من هذه المحاضرة هي كيفية النيورولوجيكال aspect examination of the tongue. إذن يتم فحص التانك بطريقتين رئيسية. الطريقة الرئيسية الأولى أنه نشوف الأناتومي مالته ونشوف إذا أكو any ulcer ونشوف إذا أكو مثلا geographic tongue benign migratory glossitis whatever. ومن ثم geographic tongue أيضا ومن ثم فحصنا tongue neurological by asking the patient to protrude his tongue وأنه خلل في أي during examination of the tanks إلها علاقة بالmotor neuron lesions ممكن أنه تكون on the surface of the tank. Thank you again, and we are ready to answer any question. إذا أي واحد عنده أي question أي سؤال ممكن يطرحه علينا. We are ready to answer that. طبعا التانك المحاضرة موجودة الPDF السابقة وراح أنزل لكم هذا الباوربوينت إن شاء الله. Thank you a lot.